الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Helicobacter pylori by Professor Mahmoud Hani Sulaiman. Definition: Helicobacter pylori is a gram-negative bacillus that persistently colonizes human stomach. H. pylori is a urease-positive spiral sheet. Most H. pylori colonized persons remain asymptomatic, but presence of H. pylori is associated with increased risk of peptic ulceration and gastric cancer. Increased evidence shows benefits associated with gastric H. pylori colonization in addition to non-disease risk. General: H. pylori is a spiral urease producing organism. We said that colonizes gastric antral mucosa in up to 100% of persons with duodenal ulcer and 80% with gastric ulcer. It is also found in normals, increasing prevalence with age and in those of low socioeconomic status. H. pylori is invariably associated with histologic evidence of active chronic gastritis, which over years can lead to atrophic gastritis and gastric cancer. Relation with gastric ulcer: H. pylori is also principal cause. Gastric acid secretory rates are usually normal or reduced, possibly reflecting earlier age of infection by H. pylori than in duodenal ulcer patients. Relation to duodenal ulcer: mild gastric acid hypersecretion resulting from increased release of gastrin and increased response to gastrin. These abnormalities reverse rapidly with eradication of H. pylori. H. pylori may result also in increased serum pepsinogen levels. Epidemiology: prevalence of H. pylori among adults is about 30% in developed countries, as opposed to 80% in most developing countries. Prevalence varies with age, so increased 10% of children are colonized. Varies the prevalence with age, so more than 10% of children are colonized. Other strong risk factors for H. pylori colonization are crowding and maternal colonization. Humans are the only important reservoir of H. pylori. Whether transmission takes place more often by fecal-oral or oral route is unknown. Continued epidemiology: smoking increases ulcer risk and cancer in H. pylori positive individuals. Diets high in salt and preserved food increase risk. Diets high in antioxidant and vitamin C are protective against cancer. This graph shows the effect of colonization with Helicobacter pylori. With H. pylori, increased risk of duodenal ulcer, gastric ulcer, non-cardiac gastric adenocarcinoma, beta cell lymphoma, and possibly idiopathic thrombocytopenic purpura, but decreased risk. It is protected in the following cases: decreased risk of gastroesophageal reflux disease and its complications, including pallid esophagus, adenocarcinoma of esophagus or gastric cardia, and childhood asthma and related allergic disorders. Clinical features of duodenal ulcer: burning epigastric pain 1.5 hours to 3 hours after meals, often nocturnal, relieved by food. Gastric ulcer: burning epigastric pain made worse by or unrelated to food. There is anorexia, food aversion, weight loss in 40%, great individual variation. Similar symptoms may occur in persons without demonstrated peptic ulcer, non-ulcer dyspepsia, less responsive to standard therapy. Complications: bleeding, obstruction, penetration causing acute pancreatitis, perforation, intractability. Diagnosis: non-invasive methods: serology, urea breath test, stool antigen test. Invasive diagnosis by endoscopy and analysis of gastric tissue. This is the modalities of H. pylori, advantage and disadvantage of each: endoscopy, culture, histology, urease detection, serology, urea breath test, stool antigen test. Please print and use this table. H. pylori infection is known risk factor for gastritis and duodenal ulcers in children and adults. The gold standard for diagnosis of H. pylori infection of the stomach is endoscopy with biopsy. Endoscopy may show a nodular gastritis of antrum. Prevention of H. pylori. Prevention of H. pylori acquisition by immunization is not routinely practiced. An important focus is on prevention of H. pylori associated illnesses, including gastric adenocarcinoma. Carriage of H. pylori has considerable public health significance in developed countries because it is associated with peptic ulcer disease and gastric adenocarcinoma. In developing countries, due to gastric adenocarcinoma may be an even more common cause of cancer death late in life. Experimental immunization of animals has promising results. It is speculated that disappearance of H. pylori may be associated with increased risk of other diseases as asthma, obesity, and type 2 diabetes mellitus. Therapy: antimicrobial treatment indicated in patients with peptic ulceration or patients considered to have high risk of gastric cancer. Treatment consists of a combination of antimicrobials and includes an agent to decrease gastric acidity. An increased proportion of strains show resistance to antibiotics. Knowledge of antimicrobial susceptibility allows optimization of treatment regimens. This is the treatment regime for H. pylori. Regime for initial treatment and regime for appropriate use after prior treatment failure. Please print and use this slide. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you.